Hi, my name is Kyle Waldman, and today I'll be teaching about urinary and bowel dysfunctions and how to manage those issues. The first topic I'll be discussing is urinary stress and urge incontinence. Urinary stress incontinence occurs to involuntary loss of urine caused by coughing or sneezing. When a person coughs or sneezes, this will add additional stress to the bladder, which in effect will cause the person to leak urine. The two main muscles that contribute to stress incontinence are the internal and external urethrosphincter. Both of these muscles become weak in stress incontinence, leading to leaking of urine. So as I was saying before, just wanted to show you that right there is the external urethral sphincter, and the one on the inside is the internal urethral sphincter. So the next incontinence that we have is urge incontinence. Urge incontinence is when someone suddenly has the urge to urinate and may end up leaking urine before making it to the bathroom. Typically the cause of this is due to an overactive bladder, which will cause the muscles in the bladder to squeeze. Squeezing the bladder will cause the internal and external urethral sphincter to relax, which will cause the person to urinate. So as you can see, we've got the bladder right there and the urethra. So if that bladder becomes overactive, that's going to, or spasm, it's going to put tightness on it, and then that's going to be causing the urethral sphincters to relax and then essentially urinating yourself. The next topic I'll be discussing is urinary irritants. Urinary irritants can irritate the bladder, causing an increased need or urgency to pee. Some examples of urinary irritants include coffee, tea, acidic drinks, dairy, and even chocolate. Yes, I said chocolate, unfortunately. Next, I'll be discussing the proper amount of fluid intake. For this purpose, I'll be giving a patient's made-up weight. So let's say theoretically we have someone that weighs 160 pounds. Once we've identified that patient's weight in pounds, let's divide that by 2, which will give us 80. So we got the daily recommendation for fluid intake, which is your body weight in ounces. So because we got 80, now we would convert that, and the daily recommendation would be 80 ounces of water per day. Some recommendations for increasing fluid intake, we'll start off with purchasing a water bottle. Purchasing a water bottle most likely increase your fluid intake because if your eyes see it, you most likely remember to use it. It's just like if you want to eat healthier snacks. Put your fruit out on the counter so the first thing your eyes see is the healthy fruit instead of junk food. Another recommendation would be to keep a journal to track your daily record of fluid intake. That way you will have visible proof and results of your progression or regression. Remember, water is valuable and will always save the day for you, so stay hydrated, my friends. Moving on, we'll be discussing the urge suppression strategy. If you ever have the feeling of like you have to urinate, just remember these 5 steps. Number 1, stop and take a breath. Sit if possible. Number 2, you're going to try to contract your pelvic floor muscles about 3 to 5 times. Step number 3, you'll take a breath. Step number 4, assess, do I still need to go? And step number 5, if I need to go, walk to the toilet. If you still have the urge that returns, repeat those 5 steps again. Our next topic we'll be talking about is how the pelvic floor can cause constipation. Constipation is when a person experiences difficulty pooping or has fewer than 3 poops per week. One major muscle that is directly involved with constipation is the puborectalis. The puborectalis is a rectum muscle that essentially wraps around the lower rectum. If that muscle becomes too tight with increased tone or even muscle spasms, that rectum will become tight, and which effect will make it difficult to poop. And this is what happens with constipation. And so, as you can see, the most medial muscle, the puborectalis. And so, the puborectalis, if that becomes too constricted, that is going to what causes constipation. So we actually need the puborectalis to relax, which reduces constipation, and then will allow you to poop easier. On the contrary, the pelvic floor muscles can also contribute to reducing fecal incontinence. Fecal incontinence is defined as not being able to control yourself from pooping yourself. During Kegel exercises, which you should be recommended to do, will actually help strengthen your pelvic floor muscles and your anal sphincter muscles, which in effect will help stop the leaks, or in layman terms, pooping your pants. And so as we can see right here, we have the external anal sphincter, and that is one of the muscles that we can help strengthen to help reduce the amount of fecal incontinence. So, there are also certain additions in your diet that can help with bowel issues, such as fiber. Fiber can increase the size of your poop, making it easier to release. The daily recommended amount of fiber per day is half your person's weight in kilograms. So let's say someone weighs 80 kilograms. So then their daily recommended amount of fiber will be 40 kilograms per day. The fiber should be a mixed soluble fiber, which will attract water, and then you have the insoluble fiber, which help create the mass of the poop. The recommended number of poops per day is 2 to 3 times a day or every other day. There are also some ways to help with bowel movements, including bowel massage. Bowel massage is a massaging technique used on muscles and body organs which help with clearing the poop. Benefits from bowel massages include stimulating peristalsis, decreasing the time that it takes to poop, and increases the amount of poop for constipation, and reduce pain and discomfort in constipation. Next, we'll be discussing toilet positioning to help with pooping. Most people sit with their feet flat while they poop, but this actually puts excess stress on the pelvic floor muscles, making it more difficult to poop. Having your feet raised above 90 degrees increases the anal rectant angle, which essentially, in other words, opens up more space, making it easier to poop. One could actually purchase a squatty potty, which keeps your feet raised. And if you can't afford one, you can sit on the toilet with your tippy toes raised, or you can you can even find something such as a cinder block or a textbook that will help keep your feet raised. So lastly, I'll also be talking about some tips on how to poop without straining. Some of those include keeping your mouth partially open and exhaling as you are pooping. And another one is bracing your stomach muscles to move forward, which will essentially widen your waist, making it easier to poop. Well, that wraps up my presentation today, and I hope you have a wonderful day.